Wrist injuries are a common concern for both athletes and workers, often resulting from trauma or repetitive overuse. These injuries can affect bones and tendons, leading to pain, reduced function, and sometimes long-term disability if not diagnosed and treated promptly. Understanding the mechanisms, symptoms, and imaging findings of wrist injuries is crucial for effective management. In this video, we'll explore the most frequent traumatic and overuse injuries of the wrist, discuss the role of different imaging techniques, and highlight key clinical features. Whether you're a healthcare professional, athlete, or simply interested in musculoskeletal health, this comprehensive overview will help you recognize and understand the complexities of wrist injuries. Wrist injuries account for a significant proportion of musculoskeletal disorders in both sports and occupational settings. They can lead to missed workdays, delayed return to play, and chronic issues if not managed properly. Early and accurate diagnosis is essential to prevent complications such as chronic instability, degenerative joint changes, and permanent functional impairment. By understanding the impact and burden of wrist injuries, clinicians and patients alike can appreciate the importance of timely intervention and tailored treatment strategies. Let's delve into the types of injuries and why a comprehensive approach is necessary for optimal recovery. Imaging plays a pivotal role in diagnosing wrist injuries. Conventional radiography is typically the first step, especially for detecting bone trauma. However, it can miss subtle or occult fractures, particularly in the scaphoid and hamate bones. Computed tomography (CT) offers superior detail for complex or hidden fractures, aiding in surgical planning. Magnetic resonance imaging (MRI) is invaluable for identifying occult fractures, overuse injuries, and tendon abnormality. Ultrasound (US) is increasingly used for dynamic assessment of tendons and can sometimes detect fractures. Choosing the right imaging modality ensures accurate diagnosis and guides appropriate management. Scaphoid fractures are particularly common in young, active adults, especially those involved in contact sports or high-velocity activities like football, rugby, and skating. These fractures typically occur after a fall onto an outstretched hand, forcing the wrist into hyperextension. Patients often present with tenderness in the anatomical snuff box, mild swelling, and pain during wrist movement. Early radiographs may not always reveal the fracture, so CT or MRI is recommended if clinical suspicion remains high. Prompt diagnosis is vital to prevent complications such as nonunion or avascular necrosis, which can severely impact wrist function. Scaphoid fractures are not detected and treated early. They can lead to serious complications. Nonunion, where the bone fails to heal, may progress to scaphoid nonunion advanced collapse (SNAC), resulting in chronic pain and wrist instability. Another risk is avascular necrosis (AVN), especially in the proximal pole of the scaphoid due to its unique blood supply. Imaging, particularly MRI, is crucial for identifying these complications early. Recognizing the signs and understanding the risks associated with scaphoid fractures can help prevent long-term disability and improve patient outcomes. Triquetral fractures are the second most common carpal bone fractures, often resulting from a fall on an outstretched hand. They present with ulnar-sided wrist pain and can be classified into dorsal avulsion, body, and volar avulsion fractures. Hamate hook fractures are frequently seen in athletes who play golf, baseball, or racket sports, typically from direct impact or repetitive loading. Standard radiographs may miss these injuries, so CT and MRI are often needed for definitive diagnosis. Early detection is important to avoid chronic pain and dysfunction. Ulnar styloid fractures may occur alone or with distal radius fractures, often after a direct blow or fall. Patients typically report pain and tenderness on the ulnar side of the wrist, reduced grip strength, and symptoms worsen by ulnar deviation. Up to 65% of these fractures may progress to nonunion, leading to chronic pain and dysfunction. Concomitant injury to the triangular fibrocartilage complex (TFCC) increases the risk of distal radioulnar joint instability. Accurate imaging and timely management are essential to restore wrist stability and function. Stress fractures occur when repetitive loading exceeds the bone's capacity for repair, leading to microdamage and eventual failure. In the wrist, these injuries are common in sports like gymnastics, tennis, and golf. For example, repetitive dorsiflexion in gymnastics can cause scaphoid stress fractures, while hamate hook fractures are seen in racket sports. MRI is the preferred imaging method for early detection, revealing bone marrow edema and subtle fractures. Recognizing stress fractures early allows for appropriate rest and rehabilitation, preventing progression to more serious injuries. Unique overuse injury in adolescent gymnasts is distal radial epiphysiolysis, also known as gymnast's wrist. Repetitive compressive forces through the extended wrist cause widening of the distal radial physes and potential metaphyseal injury. MRI may show paraphyseal edema, physeal widening, and early signs of physeal bridging. If left unrecognized, this condition can lead to premature closure of the growth plate and secondary ulnar-sided wrist problem. Early identification and modification of activity are crucial for preventing long-term complications in young athletes. Osteonecrosis or avascular necrosis (AVN) can affect the lunate Kienberg's disease or the scaphoid Preiser's disease. Kienberg's disease is more common in athletic men and presents with insidious dorsal wrist pain. Early radiographs may be normal, but MRI can detect bone marrow edema and signal changes. Preiser's disease is rare and may be idiopathic or related to repetitive trauma or steroid use. MRI helps differentiate between types and stages, guiding management. Early recognition and intervention are key to preserving wrist function. Onium-Paction syndromes arise from repetitive impact between adjacent wrist bones, leading to pain and degenerative changes. Ulnar impaction syndrome is common when the ulna extends beyond the radius, increasing joint load and causing damage to the lunate and triquetrum. Ulnar impingement, in contrast, occurs with a short ulna, creating painful contact with the distal radius. MRI is useful for detecting cartilage damage, bone marrow edema, and cystic changes. Recognizing these syndromes helps guide appropriate management and prevent chronic wrist dysfunction. Carpal boss is a bony prominence at the base of the second and third metacarpals, often seen in boxers and those with repetitive axial loading through the carpometacarpal joints. This overuse injury can cause chronic dorsal wrist pain and may be associated with instability and joint degeneration. CT provides detailed images of the bony structure, while MRI reveals associated edema and synovitis. Early recognition and management can help alleviate symptoms and prevent progression to more severe joint problems. Tendon injuries around the wrist can be traumatic or result from overuse. Open injuries often involve lacerations, while closed injuries are more common in extensor tendons and may result from acute trauma or underlying conditions like arthritis. Diagnosis is primarily clinical, but imaging such as MRI and ultrasound helps assess the extent of tendon tears and guide treatment. Early intervention is important to restore function and prevent chronic disability. Tendinopathy refers to all symptomatic tendon conditions, including degenerative changes, tendinosis, and inflammation of the tendon sheath, tenosynovitis. Overuse is a common cause leading to microscopic injuries and chronic pain. Histopathology often shows collagen disorganization and neovascularization rather than true inflammation. MRI and ultrasound are valuable for detecting tendon thickening, signal changes, and fluid accumulation. Understanding these processes helps tailor treatment and improve outcomes for patients with chronic wrist pain. Quervain syndrome is the most common wrist overuse tendinopathy, involving the first dorsal extensor compartment. It's caused by repetitive microtrauma as the abductor pollicis longus and extensor pollicis brevis tendons run over the radial styloid. This condition is frequently seen in golfers, racket sport athletes, and those performing repetitive hand movements. Patients report pain and tenderness along the radial border of the wrist. Diagnosis is clinical, supported by imaging when needed. Conservative management is usually effective, but surgery may be required if symptoms persist. Finkelstein test and the wrist hyperflexion and abduction of the thumb test are commonly used to diagnose de Quervain syndrome. Both tests are highly sensitive but not very specific, so imaging may be needed to confirm the diagnosis and rule out anatomical variations. Ultrasound is particularly useful for detecting septations in the first dorsal compartment, which can affect treatment outcomes. MRI can show thickened retinaculum, tendon changes, and fluid in the sheath. Accurate diagnosis ensures effective management and symptom relief. Initial treatment for de Quervain syndrome includes activity modification, non-steroidal anti-inflammatory drugs NSAIDs, and ultrasound-guided corticosteroid injections. Success rates for injections vary depending on the stage and anatomical factors. If conservative measures fail, surgical release of the first dorsal compartment may be necessary. It's important to address all affected subcompartments during surgery to prevent persistent symptoms. Early intervention and tailored therapy can lead to excellent outcomes for most patients. Extensor carpi ulnaris (ECU) tendon is stabilized by a fibrous subsheath. Injuries to the structure, often from repetitive stress or acute trauma, can lead to ECU subluxation or dislocation. Sports like tennis and golf are commonly associated with these injuries. Patients may experience snapping pain and chronic irritation on the ulnar side of the wrist. MRI and ultrasound are valuable for assessing the extent of injury and guiding treatment. Early recognition and management are crucial to prevent chronic instability. ECU tendon injuries can present in three main patterns: stripping of the subsheath from its attachment, ulnar-sided rupture, or radial-sided rupture. Each pattern affects the position and stability of the tendon differently, influencing treatment decisions. Recognizing the specific injury pattern is important for planning surgical repair or conservative management. Imaging helps differentiate these patterns and ensures that the chosen intervention addresses the underlying problem, reducing the risk of persistent symptoms. Proximal intersection syndrome, also known as Orsman's wrist, involves the crossing of the first and second dorsal compartments of the wrist. It's common in sports and activities with frequent wrist flexion and extension, such as rowing, skiing, and carpentry. Mechanical friction between tendons leads to tenosynovitis, pain, and swelling over the dorsoradial forearm. Ultrasound and MRI are useful for confirming the diagnosis and identifying anatomical variants. Conservative management is usually effective, but persistent cases may require surgical intervention. Distal intersection syndrome is less common and occurs where the extensor pollicis longus crosses the second compartment tendons distal to Lister's tubercle. Symptoms are similar to proximal intersection syndrome and de Quervain, making diagnosis challenging. Imaging helps differentiate these conditions. Treatment is mainly conservative with splinting and NSAIDs, but surgery may be needed for persistent cases. Recognizing the anatomical location and clinical features is key to effective management. Flexor carpi ulnaris (FCU) tendinopathy is the most common flexor tendon overuse syndrome, especially in sports like squash, badminton, and golf, as well as in repetitive manual labor. Chronic stress can lead to fibrous changes and calcification near the pisiform. Patients experience pain and tenderness on the ulnar side of the wrist. Imaging, particularly ultrasound and MRI, helps confirm the diagnosis and assess the extent of tendon involvement. Early intervention can prevent progression to chronic pain and dysfunction. Wrist pain can be localized to different regions, each associated with specific injuries. Ulnar-sided pain may indicate triquetral or hamate fractures, ulnar styloid injury, or ECU tendinopathy. Radial pain often points to scaphoid fractures or de Quervain syndrome. Central pain may be due to occult fractures or Kienberg's disease, while volar pain suggests hamate hook fractures or flexor tendon injuries. Dorsal pain can result from triquetral avulsion, carpal boss, or extensor tendon tears. Understanding pain location helps narrow the differential diagnosis and select appropriate imaging. Wrist injuries are easily missed on standard radiographs. To 25% of scaphoid fractures and many hamate hook fractures may not be visible. CT and MRI are essential for detecting these occult injuries. MRI is also superior for identifying bone marrow edema, early avascular necrosis, and soft tissue pathology. Ultrasound is valuable for dynamic assessment and guiding injection. Being aware of these imaging pitfalls ensures that subtle but significant injuries are not overlooked, leading to better patient care. Thorough clinical examination remains the cornerstone of wrist injury diagnosis. History and physical findings guide the choice of imaging studies. Radiographs provide a baseline assessment, while CT and MRI offer detailed evaluation of complex or subtle injuries. Ultrasound is increasingly used for real-time assessment of tendons and guiding interventions. Combining clinical and imaging findings ensures accurate diagnosis and effective treatment planning, minimizing the risk of missed injuries and complications. Timely diagnosis and appropriate management of wrist injuries are essential for a safe and efficient return to work or sports. Rehabilitation focuses on restoring range of motion, strength, and function. Preventive strategies include proper training techniques, protective equipment, and early recognition of symptoms. By minimizing diagnostic delays and optimizing treatment, clinicians can reduce the long-term burden of disability and help patients return to their activities with confidence. Wrist injuries are diverse and often complex, requiring a multidisciplinary approach for optimal outcomes. Early recognition, accurate imaging, and individualized treatment plans are the pillars of effective management. Understanding the mechanisms, clinical features, and imaging findings of common wrist injuries empowers clinicians and patients alike. By staying informed and proactive, we can ensure better recovery and long-term wrist health for everyone affected by these injuries. Let's review some important terms. Scaphoid, one of the carpal bones, commonly fractured, avascular necrosis, AV, and bone death due to lack of blood supply. Tendinopathy, general term for tendon disorders. Tenosynovitis, inflammation of the tendon sheath. Epiphysiolysis, growth plate injury, especially in young athletes. Understanding these terms helps in interpreting clinical and imaging findings, and in communicating effectively with healthcare providers. Managing wrist injuries often requires collaboration between radiologists, orthopedic surgeons, physical therapists, and primary care providers. Each specialist brings unique expertise, from accurate diagnosis and imaging interpretation to surgical intervention and rehabilitation. This team-based approach ensures that patients receive comprehensive care tailored to their specific needs, improving outcomes and reducing the risk of chronic complication. In summary, traumatic and overuse injuries of the wrist are common but manageable with the right approach. Early diagnosis, appropriate imaging, and individualized treatment are key to preventing long-term disability. By understanding the mechanisms and clinical features of these injuries, and by working closely with healthcare professionals, patients can achieve optimal recovery and maintain wrist health for years to come. Stay proactive, recognize symptoms early, and don't hesitate to seek expert care when needed.